Shockwave therapy
for the prostate, not for erectile dysfunction.
Yeah.
And then coming back to my private practice, where now suddenly I was exposed to this group of young men behaving like what I thought old men should behave, because when I was in the government hospitals, I'll be seeing old men who now require a surgery to remove the prostate or trim the prostate, who have been having urinary symptoms for the last 20 years, but were managed by the local health clinic with muscle relaxants all this while, eventually land up on my table requiring surgery. Now I'm seeing the guy who's requiring that muscle relaxant, who is now 20 years younger.
Yeah.
And I'm wondering, oh my God, the problem started here. I never saw that patient at that time when I was working in the government hospital. But now in private practice, I'm seeing you at this stage of your life. And I'm wondering, why are you having problems now? Because when I saw you at that 50 or 60 years age, I did not reflect back 20 years.
Of course.
I'm seeing you now, I'm going to treat you now. But now that I'm seeing you at 30...
And surgically.
And now that I'm seeing you at 30, I'm wondering, why are you suffering from this? Because I remember only 60-year-olds have this. And that's when I realized, no, actually, I'm seeing that 60 after 20 years of him having being treated by another doctor. But that's what got me thinking, oops, I think I'm missing out something. And that's when, thanks to a physiotherapy book written by an Italian physiotherapist who invented visceral manipulation. I'm sorry, I've forgotten his name. It's very famous. He mentioned about how important inflammation of the prostate is and how prevalent it is.
Again, I think we have to explain what visceral in that.
So visceral manipulation is when a person externally uses fingers and can actually manipulate your organs inside. Your liver, your gallbladder, the bladder, even the prostate for that matter.
Correct.
And this is something only very specialized physiotherapists know how to do. And
it's not easy and it's not undangerous. I mean, doing it in a wrong way.
It can be extremely dangerous, of course. Yes. So that also then spurred my interest, and fair enough, I decided to do a little bit more reading, and that knowledge is there. I didn't have to look too far. It's there to tell you that most patients actually have prostatitis. Most patients have non-bacterial prostatitis. 90% of prostatitis is non-bacterial, yet first-line treatment is antibiotics.